if you're a lady below the age of 40, don't joke with this information I want to tell you now. Don't forget to share this video with your friends and sisters. I will be talking about this very infection that causes infertility in women and that which majorly affects the female reproductive organs. So we'll be looking at PID, pelvic inflammatory disease. This is an infection of the female reproductive organ that is majorly caused by sexually transmitted bacteria. Examples of such bacteria are Chlamydia trachomatis and Neisseria gonorrhea. This infection affects the uterus, fallopian tubes, ovaries, and surrounding tissues, so which often lead to inflammation, blockage, and also can cause pockets of infected fluid, otherwise known as abscesses, to develop in the reproductive tract. This can cause permanent damage to the reproductive organ if untreated. And this disease can be symptomatic and asymptomatic because the signs and symptoms of pelvic inflammatory disease can be difficult to detect, while some women may not even experience any signs or symptoms at all. So as a result of this, you might not realize that you have it until you have trouble getting pregnant or until you start developing chronic pelvic pain. Okay, so these are the signs and the common symptoms of PID. Number one is lower abdominal pain, which is the most common symptoms. Then secondly is abnormal vaginal discharge, such as discharge of a yellow or greenish discharge that is accompanied by foul smelling discharge. So the third one is pain during sex, painful urination, irregular menstrual bleeding, fever and chills, and this normally occurs in severe cases. And lastly is nausea and vomiting. This occurs if the infection is in chronic stage. So let's look at the danger and complication of an untreated PID infection. Number one, chronic pelvic pain. PID can cause pelvic pain that may last for months or years, and it can cause scarring of the fallopian tube and other pelvic organs, and it can also cause pain during sexual intercourse and ovulation. Okay, secondly, it can cause infertility or trouble getting pregnant. So blocking of the fallopian tube can block eggs from meeting sperm. So study shows that about 1 in 10 women with PID may become infertile if untreated. So the more times you have had PID, the greater your risk of infertility. And delaying treatment for PID can increase your risk of infertility. And thirdly is ectopic pregnancy. PID is one of the major causes of ectopic pregnancy. If a fertilized egg gets stuck in a blocked fallopian tube, it may grow outside the womb, and this is life-threatening emergency. The fourth one we'll be looking at is tubal factor infertility. PID can cause permanent damage to the fallopian tubes and make natural conception very, very difficult. The last one we'll be looking at abscess formation, otherwise known as pocket of pus. You understand? We can also call it tubal ovarian abscesses. This form in the fallopian tube or ovaries. This can burst and spread infection, which can be life-threatening. Now, when do you need to see a doctor? See your doctor or healthcare provider if you experience any of the following I'm going to mention. Number one, if you are having a severe pain in your abdomen, consider seeing a doctor. See your doctor if you are feeling nauseating and vomiting. See your doctor if you have fever with a temperature higher than 38.3 degrees Celsius. See your doctor if you are having a foul smelling vaginal discharge. It is crucial for you to talk to a doctor at this very point in time. Don't manage it on your own. But in a case where you have signs and symptoms of PID that are not severe, still see your doctor. Having vaginal discharge with an odor and painful urination or bleeding between periods can also be symptoms of a sexually transmitted infection. So if these signs and symptoms occur, stop having sex and quickly book an appointment with a doctor. Prompt treatment of a sexually transmitted infection can help to prevent PID. Okay, so here are some of the preventionary measures you can take to reduce your risk of contracting pelvic inflammatory disease. The first measure you can take is practicing safe sex. Ensure you use condoms every time you have sex and limit the number of sexual partners And also ensure to ask about your potential partner's sexual and medical history before you move on. Okay. Secondly, talk to your healthcare provider about contraception. Many forms of contraception do not protect against the development of PID. So using barrier methods such as a condom can help to reduce your risks. Even if you take birth control pills, use a condom every time you have sex with a new partner to protect yourself against sexually transmitted infection. Then, very important, get tested if you're at risk of STI. Make an appointment with your doctor as early as possible. Early treatment of an STI give you the best chance of avoiding PID. Then, fourthly, request that your partner be tested too. Very crucial. If you have PID or STI, advise your partner to get tested also. This can prevent the spread of STI and possible reoccurrence of PID, and also to avoid treating the same infection over and over again. Prevention is always better than cure. Take responsibility for your health and well-being. If you like what we are doing here, ensure you like and share this video. This is where we'll be calling it a day. I remain your friend Oludaisi Olukayode. So stay safe and stay healthy. See you next time. Bye bye.